Is a preview of the lecture video available on www.sonoshare.in on the topic sonography of ectopic pregnancy. Short snippets of the various parts of the lecture video will follow, more common in ART induced pregnancies. The uncommon sites are interstitial, previously called corneal, and it is end up as a tubal mole, which can also, when it then there is breach, it can result in diffuse intraperitoneal hemorrhage, or it can undergo complete absorption. Pregnancy is by combined use of endovaginal ultrasound and serum beta abdominal scan, irrespective of whether the bladder is full or empty. Why this should be done? 1,000 to 30,000 cases. So it is very rare. So when you see an intrauterine gestation, you practically excision. So there is an eccentric cystic area in endometrium and is round in shape with echogenic walls because of trophoblastic reaction. So the pregnancy and rules out ectopic, but it is seen only in 50% intrauterine pregnancy, and there will be only one decidual layer all around the sac, all around the. Then that rules out intrauterine gestation. But is first do no harm to early pregnancies. So as a result, you should not use the word pseudo gestation. It is very specific for ectopic gestation. No, without any embryo or yolk sac. So when you see this, it is 95% specific for ectopic gestation, and then it's a high sign of high probability of ectopic, which is seen here in an ectopic. But the same indication of the gestation sac in the carnova, one of the carnova of the uterus, and there will be myometrium separating this empty uterus. The endometrium is normal, empty cervical canal, and you see a sac in the anterior part of the, because there is no myometrium in between. So these are the signs of abdominal pregnancy. So because the gestation grows in the ovary, rest of the ovarian tissue is stretched around it, causing the claw or the beak sign, as shown by the blue arrow. And there may be in the rudimentary horn. Then the diagnosis is straightforward. This is very rare rudimentary horn with a uniconvate uterus. So with all these featured uterus, then more probable diagnosis is uniconvate uterus with a tubal ectopic gestation. A dedicated cervix, then it will indicate a didelphys with pregnancy in one rudimentary horn or an abdominal pregnancy. Both are possible. And on color Doppler and real time, you may see an embryo with embryo heart pulsations in both the locations. The gestation sac in the cervical canal, and with embryo or appearance of mole, and color Doppler there is low resistance flow. So with a very high beta HCG, then the raised beta HCG, and on endovaginal you don't see an mass with gestation sac, and when in real time you see by the side of extra or intrauterine pregnancy on transvaginal ultrasound scan may also increase. So there is an increase in the after 48 hours doubling of the beta HCG. So HCG ratio is 2. Suppose it is not confirmed, either of them not confirmed, then you repeat HCG after 7 days. Ovarian ruptured ectopic, where but the differentiating points are you see the stimulated ovaries, and this ovary, the appearance is heterogeneous, and on color Doppler you see patient do not have timely access to medical institution. And during medical management, follow up with ultrasound. The clinical benefit from routine serial ultrasound after treatment, medical treatment, is for endovaginal scan is normal. You don't see intrauterine pregnancy or extrauterine pregnancy, then it is a pregnancy of unknown location, PUL, and where you should do a repeat beta HCG, and depending upon the beta HCG ratio, accordingly managed. In all these situations, having gone through the preview, if you wish to listen to the main lecture video, go to sonoshare.in.